you are unmuted, notice. Okay, can you hear me now? You unmuted us?
Yeah, you're fine now.
Hey, Scott?
Hey,
What about this?
Yeah, can you get that, please?
Have you heard from Dr. Whitney?
Did you send him a text?
Let me,
All right, let's do it. All right, good morning, folks. It is time to start our press conference. With us today is Scott Stevens from Overton County Health and Rehab via Zoom. Tim McGill, Livingston Regional Hospital CEO via Zoom. With us present, Greg O'Donnell, Chamber of Commerce Director, Andy Langford, Overton County Health Department, Megan Reeder, Overton County Health Department, and Miss Ann Stamps, Del Hollow Mental Health. As we start, we'll start with a prayer this morning, and then we will start with our panel. Let's pray. Dear gracious Heavenly Father, we thank you for this day and all the many blessings. Lord, we thank you once again for allowing us to come together as a community and perhaps make some decisions and may they all be according to thy will. We pray that you give us the guidance and the wisdom that it takes to move our community forward. Lord, and we pray for the victims that have suffered from this deadly virus called COVID-19. And Lord, we pray that you put thy hands around them, make them comfortable as much as only you know how. Lord, we ask you to bless our country and the leaders, that you'll give them the knowledge and wisdom to lead their country in the right direction. Pray for the families that have lost loved ones. Forgive us of our sins. In Christ's name we pray. Amen. Okay, so the report, we'll start with the city here. So City Hall has reopened the lobby for guests and for business to be conducted 8 to 4:30, of course, Monday through Friday. We are, however, asking customers to wear a mask and gloves when they enter City Hall. And we have those masks and gloves provided for you, of course, of no charge at the front door of City Hall. We are no longer half-staffed. We are city employees are now back at work. So we're back full steam ahead, back to work. Some other announcements, the city pool will be closed this season due to the several different reasons. One, COVID-19. The other reason is simply there needs to be some repairs over there. We've been hesitant about pulling the plug on that, but now just seemed to be a good time. And if we would have stayed open, they still wanted us to have under 9 people there, and normally we have 3 or 4 or 5 city employees on staff. So with that, could only have 3 or 4 swimmers, so it just was not economically feasible to do that. A decision made today, Cal Ripken spring and summer leagues have been canceled this year. We will evaluate, and this is due to the COVID-19 pandemic and trying to limit social gatherings. As you know, that when we do have ball planned, we normally have hundreds or 1,000 folks at the park in one night. So the Cal Ripken spring summer season has been canceled at this time. We will be refunding the money. Remember, we'll have 300 or 400 folks to reimburse. So give us, everyone should have their check to them. We will mail them their check by May 22nd. If you paid online through a credit card company, we'll be watching your accounts, and you should be reimbursed in the next 2 weeks. We're saying May 22nd, everyone should receive their funds as far as reimbursement as Cal Ripken did. Now, as fall, we're still evaluating the fall summer leagues, the fast pitch leagues, the summer baseball leagues. So we'll make that decision probably in August to have a September league. Starting June the 1st, the city will go back to having live meetings. Our Livingston City Council and the Plan Commission meetings and all other boards will have their regular scheduled meeting in person, or they can do Zoom. I'm going to leave this up to the individuals that are on those respective boards. If they would like to use Zoom, we have that capability. If they want to do a conference call and listen in on the meeting, they can have that capability. We have that capability as well. But for the ones that want to be live and in person, we will have that. We will be meeting starting June 1st like that. So that is one more announcement. One more announcement. There will be parties again soon and family gatherings. There will be parades and sporting events and concerts to help our communities when they come back together after COVID-19 pandemic. I'm asking you to please respond to the 2020 census now. Spend a few minutes online today to impact the next 10 years of funding of healthcare, infrastructure, and education. We all know how important these are, so please go to 2020census.gov and respond today to make Livingston's tomorrow brighter. The Census Bureau also still has jobs available for the residents of Overton County. They are hiring five or more people from our community to help get an accurate count once the self-response phase has expired. If you'd like to help share the future of Overton County and Livingston, go to www.2020census.gov/jobs. So at this time, I'll call Mr. Greg McDonald from the Chamber of Commerce to the podium.
Thank you, Mayor. Good morning, everyone. We've got a few updates based on the communication we've received from the Chamber and with the city and county. Number one, we'll start off with the stimulus checks. We've had a lot of people that have received their stimulus checks, and we've verified that. However, there's a lot that have not received their stimulus checks at this point in time. So if you've not received yours or you want to check on the status of your stimulus check, go to www.irs.gov and then click on My Paperwork. Get My Paperwork. And that way it'll take you to an area where you put your own personal information in, and it'll give you the status if you're going to receive your stimulus check, what the status is, or in some cases we have found that the person might have been ineligible for some reason on the stimulus check. Again, if anybody needs any help on any of that, please call the Chamber of Commerce and we'll be there to assist you. Unemployment. Well, there you have to check on your status there. Again, you have to go online or you can call the Chamber, we'll assist you. www.gov, and that'll check your check status from a standpoint of unemployment. We do know that they've been behind somewhat, but that'll give you a status of where your own personal payment may be. I want to talk about the small business loan through the PPP program. As you know, we recently, on the next phase, were allotted more additional revenues for the small business, and there's now available for the, again, the recent stimulus phase. But what you need to do there is you need to go to your banker. That's where the information and the application starts. It's at your own individual banker. And again, I will stress that if you have issues on any of that, please call the Chamber of Commerce and ask for myself or Shannon Cantrell, or leave a message and we'll get back to you right away. Also, as we move through this, the governor, of course, continues to send out updates. I went into the office yesterday just to make sure there was no new updates, because it does change quite rapidly on the status of what's going on. Because this, again, uncharted territory, as the mayor said. But there's a Tennessee pledge. You go online and receive that. And I've got a copy here. And if you would like, any business or any individual would like the Tennessee pledge, it's to reopen the Tennessee and the responsibility, such as restaurants and so on, as the mayor mentioned, as far as social gatherings. You can call the chamber, we'll send you one, or you can go online to Tennessee.gov, and that'll get you that. But we'll be happy to forward you, send you information on that. Other questions that we've received, and this is really for employers, questions. I'll just use an example. How do I report an employee who refused to call back to employment? Of course, they're receiving unemployment, and our concern is, people going back to work. Of course, you got to remember, unemployment is only temporary. But we have a whole section. I won't go through each one, but from an employer standpoint, small business or large business, you can call the chamber and I will forward you that information, and it will give you how you should answer that or deal with employees as we call them back to work. Other than that, I want to thank you, Mayor, and Godspeed to everyone. Thank you.
Thank you, Greg. Next in our panel, we're going to have Overton County Health Department, Mr. Andy Lang, Ms. Megan Rick.
I'm Andy Langford, Director over the County Health Department. I'm going to give a COVID-19 update. As of May 11th, the state of Tennessee has tested 261,869 people for the COVID-19 test. We have 14,985 cases statewide across the state, which has resulted in 243 deaths of Tennessee citizens. In Overton County, we have tested 772 people, and we now stand at 11 cases here in Overton County with 0 deaths. Going back to this, I want to reiterate that one of the main weapons that we have at our disposal to tackle this, to kind of find out where this is in our community, to find out where different groups are, different clusters, is testing. And we encourage testing. We are at the health department testing every day, Monday through Friday from 9 to 3 o'clock. We still have the National Guard on site. 3-person medic team. They're working with Department of Health employees in a humanitarian role. At this time, if you feel like you want to test, you're welcome to come get one. These tests are free. If you're having any kind of symptoms, we've encouraged that over the past several months, but at this time, we're just trying to get as many people tested as we can. The more numbers, the more data we have on that, it works out better for us to kind of see where this is in our community. So, Monday through Friday, 9 to 3 at the health department on 5880 Bradford Hicks Drive in Livingston. Our phone number is 823-6260. And this is a free test done through in a drive-through manner. You drive through, you'll see in our parking lot where it's set set up for a drive-through situation. You don't have to get out of your car, you stay in your car, it's an easy test through the nasal swab, and we will then be getting results back to people anywhere from within probably 2 to 4 days. The testing and the results are coming in quicker than they used to be. I want to talk real quick also about masks. You're hearing an awful lot now about masks. There have been different guidelines, different preparations discussed that if you're going to be out in the community, now it's probably for your safety or safety of others that you wear a mask. With that being said, we do now have masks at the Overton County Health Department provided by Governor Bill Lee's Unified Command Group. All the health departments across the state have received and will be receiving more of these masks. The hope is that every citizen in Tennessee, we will have enough of these masks in the next few days, a few weeks, that will be coming in where we can distribute a mask to everyone who would like to have one. This is a cloth mask. We are giving these out now to people as they come by. It's washable, reusable cloth face mask, and it has a little TN on it here as well. When you come by the health department in a drive-through manner once again, or call and come in, or we'll bring the mask out to you. We're giving out as many as you need for your household. We would ask that if you have 3, 4, 5 people in your household, we are happy to give you these masks for people. But I mean, at this time, we do have a limited amount. We will be getting more masks in. And hopefully everyone who wants a mask will be able to get one, but we're not able to give these out in a mass gathering right now. If and when we do receive these, we'll then hopefully be working with some of our community partners to make sure that we're able to get these masks out there in a wider distribution. A couple of things on masks. Masks should not be used on any child under 2 years of age, anyone who has trouble breathing, or anyone who could not remove the mask with assistance. So these are not medical masks. They should not be used for medical or commercial use also. The Overton County Health Department, we encourage wearing a cloth face mask or facial covering when in public to help survive the spread of COVID-19. A really important thing to remember is that masks alone are not a substitute for social and physical distancing. I know that with opening up the economy, and Mayor Hayes mentioning here, he's going to be having community meetings. I know that in all meetings that are going to happen in the future, they'll be practicing physical and social distancing. I believe this is just the new normal of what we're going to be dealing with until we have an antibody test or a cure, a vaccine down the road. So continue to try to keep 6 feet between yourself and others when wearing a face mask, and just practicing the guidelines that we've been talking about here over the last several weeks. Thank you for your efforts, and we thank you for letting us come and provide information and give you these weekly updates. With that, I'll turn over to Megan Reeder, nursing supervisor at the health department. She has a little information.
Thank you, everyone. Just some of the things I wanted to talk about, as Andy brought up the mask, is kind of some do's and don'ts of wearing a mask. The masks that we have available, like he said, are cloth masks for the general public. The little TN emblem goes on the top where you can see the TN, and that way you know you have the top or bottom. So that was just a cute way to help us know which was top and which was bottom. So some do's of wearing a mask: wash your hands before putting on the mask, after touching it, and before you remove it and after removing it. So any germs that may have come in contact with the mask during the day, if you remove it, then you now have those germs on your hands, so you need to make sure and wash your hands for that. Wear the mask so that it fits snugly. I know that sometimes it's a tie mask, and that you don't want to pull it too tight where it hurts the back of your head, but you would also want it where it fits snugly around the nose and around the chin and the cheeks, and that way we don't have droplets coming through the side of our mask. You want to cover your mouth, nose, and chin with the mask. I see a lot of people that will pull a mask down below their nose, and that does absolutely no good. We can close our mouth, but we cannot close our nose. So always make sure that your mask is up above your nose where it needs to be. Also, a lot of people will pull their mask down below their chin. You also have to think you're going to touch this area just as much as you're gonna touch your face, and we wouldn't like you to do that, but if your neck is contaminated and you pulled your mask down and then you pull it back over on your face, everything that was on your neck is now right at your mouth and nose. So that's something to be conscious of too. Avoid touching the mask as much as possible, because we don't want those germs to go through. And that's also a mask. It's a barrier between the droplets, but it's also a nice reminder of, hey, I have this on my face. This is a good time to not touch my face, because we know that's one of the number one ways that this virus gets in is by actual hand transmission. So, and these are cloth masks. They are washable, so we do recommend that you wash them regularly, especially if they become soiled like you think so. So some more don'ts on the mask. Don't take your mask off to speak, okay? So if you're with someone right now and you take your mask off, that does absolutely no good, because then you're in face-to-face with that person. That's actually when you want your mask on. So if the mask is damaged for some reason, we don't want you to wear it because it won't properly protect you. And then also, we don't want to put the mask on someone that is unable to get the mask off, as Andy was saying. So a child under 2 years of age, we would not want to suffocate anyone with these masks, and that's what they're afraid of. So our children, the way to protect them is to not have them in large crowds in the first place. So if they're not in those large crowds, they're not going to need that mask. So I'm going to reiterate, we'd really recommend children not go into the grocery stores and the retail stores and things like that. We would have you leave them with a responsible adult, and then one person go and do the shopping as they need to. Another thing that I'd like to talk to you all today is antibody testing. We've had a lot of calls at the health department about that. We are not currently doing antibody testing at the health department, but we would like to educate you all on this. We are doing the viral testing, which is the nasopharyngeal swab, so that's the swab up the nose. The antibody testing, though, is done with blood, and what antibodies are, they are proteins that help fight off infections, okay? So antibodies cannot be used to diagnose a current infection with COVID-19. You're going to see antibodies about 1 to 3 weeks after an infection. So if you want to know if you're currently infected, you need a viral test, which is the nasopharyngeal swab, and we do have those at the health department every day from 9 to 3. So if you have a positive antibody test, that means you were previously infected with either COVID-19 or a related coronavirus. So that's kind of the stipulation that's going around with this antibody testing right now, is if you do get it done, you're going to want to know if it's specific to COVID-19 or if it's all related coronaviruses. So that's the difference. So just know that there is a difference and be aware of that and educate yourself about that. So it is unclear at this point whether antibodies will actually protect you from getting sick again, but that is something they're looking into, if it provides some immunity whether you have those antibodies. And another thing they're looking at is antibodies from a previously infected person. They can use those to help the really, really ill with the COVID-19. So there's a lot of research going on about that. You can test positive for antibodies and never even know you had the COVID-19. You've heard this a lot about being asymptomatic, so you very well could have had it and cleared it and never had the first symptoms. So those antibodies are pretty reliable on, yes, whether you've had something or no, whether you've not. What is not necessarily completely clearly defined with the different testing is it COVID-19 only, or is it the other related coronaviruses? So now if you've had a negative antibody, that means that you've not been infected, but that doesn't mean you couldn't currently be infected, because again, antibodies take 1 to 3 weeks. So it's just checking for a previous illness. So if you think you are currently infected, you would need the viral test, which is the nasal swab. If you have any other questions, you can call us at the health department. We'll love to answer any questions you all have, and I hope everyone has a good day. Thank you.
Thank you, Andy, and thank you, Megan. Next, we will go to Mr. Scott Stevens, that is via Zoom. Next, Scott from the Overton County Health and Rehab Center. Go ahead,
Thank you,
Scott.
Mary Hayes, and good morning, everybody. Here at Overton County Health and Rehab, we don't have any changes to report this time. From the last time we updated the public, we're still continuing to follow our standards of precautions, just as we had put in place. So we're continuing our plan. It's working. Overton County Health and Rehab continues to be
Thank you, Mr. Scott Stevens, for the great report there. Nick, thank you. Again, I had to hit my microphone. Thank you for the great report there, Mr. Scott Stevens, Overton County Health and Rehab. Next on the phone, we have CEO Livingston Regional Hospital, Mr. Tim McGill. Mr. McGill.
Good morning, Mayor Davis and City County leaders. Hillary has just recently restarted elective surgeries, tests, and other procedures. This is all effective this past Monday, May 4th. Give you some examples of surgeries we're now doing on a gradual basis: endoscopies, hysterectomies, most outpatient orthopedic procedures like fractures, arthroscopic knee procedures, general surgery procedures, and some examples of those we're doing now are gallbladders, appendectomies, and also decline surgery such as hysterectomies. Additionally, we're doing now imaging testing, CTs, MRIs, mammograms. Also, we have restarted outpatient physical therapy and occupational therapy. On the testing side of our hospital, as patients present that are symptomatic in our ER or if they're admitted, we've conducted at least 74 tests to date on patients. 2 were through our ER were positive. We've had 1 overnight stay patient that was tested positive. All 3 patients were sent home and quarantined, and each of the 3 they've all recovered. Also, I want to mention we maintain an inventory of testing. We have over 300 test kits here in our hospital, and we use as necessary. And personal protective equipment, which is very important for hospitals. Our goal is to maintain an inventory of 14 plus days in gloves, masks, N95 gowns, for example. And lastly, we monitor trending of our county, region, and state, and it helps us determine what we can go forward in doing in terms of further testing and surgery. Overton County cases are flat. Also, regional cases are flat. Our state is currently up slightly, but in the beginning stages of flattening. The same for our nation. Lastly, I want to congratulate Overton County Health and Rehab for the tremendous work they're doing, taking precautions and prevention of the spread of COVID-19. And Overton County Health Department for their work around data, their Monday through Friday testing, their patient interaction on behalf of all healthcare organizations. We really appreciate the work. It's truly teamwork here in this community, and we work with our partners in all healthcare agencies and our city and county officials. Thank you, Mayor.
Thank you, Mr. McGill. Next, we will have Miss Ann Stamps, Del Hollow Mental Health. Go ahead, Ann.
Thank you, Mayor. I just wanted to remind everyone in the community that we're still providing services at Del Hollow Mental Health Center, 501 Spruce Street. All of our services now are being conducted over the telephone, thanks to the waivers of TennCare, Medicare, and some other insurance providers. Those services consist of medication management, therapy, and care coordination. We know that things have been a little odd lately with school out, with the tornadoes that we experienced in March in part of the Upper Cumberland, and with COVID-19. So we're still having first-time appointments. So if you are someone that may be experiencing some symptoms of a mental illness, depression, anxiety, fearfulness, you can still call our toll-free number to get a first-time appointment. That's 1-877-567-6051. Again, that first-time appointment will be conducted over the telephone. Our goal right now is to get that caller, to get a call back to that caller within 30 minutes of them calling our 1-877 number. An intake specialist will conduct that very first time appointment, gather some information, talk about treatment options, for that particular individual. If a medication evaluation needs to be done, that client will be called by one of our medical providers, and then finally called by one of our care coordinators to enroll them in care coordination and follow up on any services or resources that person may very well need. I also want to remind folks about behavioral health safety net. That's for adults that are 18 years old or older, that don't qualify for TennCare, that do have a mental health diagnosis, and they're at or below the poverty level. When you call that 877-567-6051 first-time appointment number, you can inquire about that, and we can go ahead and start that process now. Again, the state has been very gracious in reducing some of the restrictions that we had earlier prior to COVID-19, so that we can be sure that all of our folks in our communities get the mental health services they need. Last but certainly not least, I want to remind everybody that crisis services are still available. In our area, adult crisis number is 1-800-704-2651. For our children and youth, crisis number is 1-866-791-9223. Also a reminder that the Crisis Stabilization Unit, the walk-in center at the Cookville location, is still open 24/7. Obviously, they're doing some screening before anybody is admitted, but certainly folks can go there or call the crisis number 1-800-704-2651. Thank you, Mayor, for the opportunity.
Yes. Thank you, Ms. Stamps. Thank you very much. Last but certainly not least, Overton County Director of Schools, Dr. Mark Whittingham.
Thank you, Mayor Hayes. Just a couple of quick announcements. One, Friday will mark the end of our academic delivery of materials. And each school has developed a plan for the return of school equipment and the pickup of personal items that students may have left in mid-March. You can check the websites or contact the schools for those instructions. We will continue to provide meals through the month of June, at least through the month of June. Currently, we have served over 100,000 meals since March the 23rd. And the process for meal delivery will continue as it currently is. We are in the process of developing plans for the beginning of the 2020-2021 school year, with the hopes of a full return to school. We also currently plan to open facilities on a limited basis to our student athletes on June the 1st. And of course, that will be determined by the local guidelines at that time. Also, we're hoping for a full return to athletic competitions in the fall as well. With that, that's all that I have right now. Just want to say thank you, and God bless each of you. Continue to pray for our community and our country. Thank you.
Well, thank you, panel. Thank you for everyone being here today. This concludes our meeting. God bless Livingston and Overton County. Thank you.